Hello, everyone. Welcome to your 2022-2023 TRS ActiveCare annual enrollment presentation. My name is Mike Martinez, and I'm one of a group of TRS district ambassadors from across the state that help support all regions across Texas. So today, we're going to be reviewing the TRS ActiveCare health plan benefits, as well as our value-added programs. In today's agenda, we're going to be covering your new plan year benefit changes, our Prudent RX specialty drug program, as well as our new insulin price cap. We'll also be looking at your health benefits, which include Blue Cross Blue Shield of Texas tools and resources, as well as viewing quick samples of your new medical ID cards. And lastly, we'll also review your value-added programs, which include our new Learn to Live program and our expanded member rewards. So let's dive right into your plan highlights. Overall, there were very minimal changes to the plans from last year to this year. There was a copay added to the virtual health services under Teladoc, which we'll go over in more detail in the following slide. Now, the big news this year for folks that may be taking insulin medication, there is a new legislative cap limit that's been implemented, which means participants will only be responsible for a copay amount of $25, and that's for a 30-day supply, $75 for a 90-day supply. Now, there was a change to the maximum out-of-pocket on the HD plan, and that's just to align with federal limits, as you can see on the right side of the screen here. And lastly, there have been some positive changes in the administration of specialty drugs. We know that some of you may have some questions there, so we'll go over more information in one of the upcoming slides, but rest assured that outreach will be made to every specialty drug patient. You can also contact a CVS representative at 866-355-5999 and state pharmacy when prompted to get more information. Okay, so let's go ahead and review the plan highlights for the two plans that are on the physician-driven statewide network, the ActiveCare Primary and Primary Plus. Now, you may be wondering what the beige colored boxes represent. Those represent areas where the Primary and Primary Plus plans differ. Primary plan on the left has the lowest premiums, in addition to offering copays for your doctor's visits and prescriptions prior to meeting the deductible, whereas the Primary Plus plan here on the right offers a lower deductible, lower coinsurance, and maximum out-of-pocket. However, it does have a slightly higher premium. Now, these plans are popular because they provide access to a broad, statewide network of providers and facilities, and they're both curated specifically for TRS ActiveCare participants. Since these are physician-driven plans, participants will have to select a PCP, which they can locate through our Provider Finder tool on our TRS website. Also, with regards to the pharmacy benefits under the primary plan, the pharmacy deductible has been integrated with the medical, and on the Primary Plus plan, there is a $200 brand name drug deductible that also applies. So I just wanted to point that out. All right, so now let's take a look at the plan highlights for the two plans that are on the nationwide network, the TRS ActiveCare HD and TRS ActiveCare 2. Now, the TRS ActiveCare high deductible plan on the left does have a lower premium and works as a health savings account. So essentially, employees can utilize this plan for their medical care and prescriptions tax-free. Now, under this plan, the deductible must be met before the plan kicks in and coinsurance applies. Also, changes to the HD plan include the maximum out-of-pocket outlined at the top left of the chart, in addition to the Teladoc consultation fee. Now, the TRS ActiveCare 2 plan here on the right is closed to new enrollees, but existing participants can stay enrolled within the plan. As you can see, this plan does have a lower deductible and copays for many of its services. ActiveCare 2 also has the same update related to the Teladoc medical copay outlined on the chart here as well. And both plans do not require participants to select a PCP, and referrals are not needed for specialty care. So two great options here. TRS Virtual Health. Over the last couple of years, especially with the pandemic, telemedicine has become very popular, and we've seen an increase in utilization. And the reason for this is because it's very convenient, it's reliable, and it still offers that great medical care that you're accustomed to. So under our plans, TRS Virtual Health choices are powered by Teladoc and ReadyMD. Now, these services allow participants to access quality healthcare from home, or if they're on vacation or traveling, without having to go to an actual doctor's office. To the left there, we've outlined some of the features for Teladoc. They offer services for general medicine, which include a variety of non-urgent conditions as listed here. For medical, there's a $12 cost for Teladoc for those on the Primary, Primary Plus, and ActiveCare 2 plans, and a $42 cost for participants on the HD plan. In addition, Teladoc does offer confidential mental health services that are available for adults 18 and older from a licensed therapist, psychologist, psychiatrist, or certified drug and alcohol abuse counselor. However, there is a cost $70 fee per visit for the primary, primary plus, and active care 2 plans. For the HD plan, the deductible must be met before the coinsurance applies. For more information and to set up an account, there's various ways to do that. You can either visit the website listed here, you can call the phone number for help from a representative, or you can just download the app from the Apple Store or Google Play Store. Now on the right-hand side there, you'll see ReadyMD, which is another great option. They also provide quality medical services with live face-to-face diagnosis and treatment via online, smartphone, or just over the phone in general. Participants can see and speak with a board-certified physician 24/7 who can diagnose and recommend treatment as needed. For medical services, ReadyMD has no cost for participants on the primary and primary plus plans and active care 2 plans, and there is a $30 cost for those on the HD plan. Now, participants can quickly set up their accounts by visiting the website listed, or they can just register through the ReadyMD customer service by calling the phone number on your screen. And with that said, we do encourage you to register for these options, really just to get prepared. So when the need does arise for these services, you're already registered and ready to go. For me personally, I utilize these services whenever I travel. I travel across the state quite often, visit family. So it's just a quick and easy way for me to access my health care while I'm away from home. So I definitely recommend. And also, one last note, another added benefit is that the insured can share this service with family members that don't already have access to virtual health. They could just add them to the subscribers portal. There is a $45 cost per visit for Teladoc and $35 cost for ReadyMD. So moving on to the diabetic meter and supplies. As you know, regular blood glucose testing is essential for members with diabetes. One of the best ways to manage diabetes is to check your blood sugar every day with a glucose meter. The diabetic meter program is a value-added program offered by prescription benefit plans that provide eligible participants with no-cost blood glucose meter to help monitor blood sugar levels. It also helps manage your overall health and avoid any unnecessary hospital expenses. Along with a free one-touch meter, the plan offers diabetic supplies at no cost to you. You may even be eligible to obtain a 90-day supply of diabetic supplies at any Retail Plus stores or Caremark mail order pharmacy. The no-cost supplies includes needles, lancets, syringes, and the one-touch test strips. For tools and resources to help manage diabetes, please visit the website listed on the screen, or you can just call CVS Caremark Member Services at 1-800-588-4456. So as we touched on earlier, I'm excited to share information related to our new diabetic insulin cap. Starting September 1st of this year, there will be a cap on the price of formulary insulin medication set at $25 for a 30-day supply and $75 for a 90-day supply. Now, the Texas legislature recently passed Senate Bill 827, making this possible, making insulin less expensive for those on specific health plans, such as the TRS ActiveCare Primary, Primary Plus, and Active Care 2 plans. Beginning in the new year, insulin medication will be covered under your copay only, which means that it won't apply towards your deductible. However, it will apply towards your maximum out-of-pocket cost. So to check if your insulin is on the covered formulary list, just visit the website listed here on the screen. Now, if your insulin is not on the list, don't hesitate to contact the CVS Customer Care Service for one of our representatives. They'll be able to assist you with a formulary exception process. And again, the number to call is 1-866-355-5999. All right, Prudent RX specialty medications. So in order to provide a comprehensive and cost-effective prescription drug program for members, TRS has partnered with Prudent RX to offer the Prudent RX copay program. And this is for certain specialty medications. So starting September 1st of 2022, members under the Primary, Primary Plus, and Active Care 2 plans will be eligible to enroll in copay assistance programs for their specialty medication. Out-of-pocket costs for prescriptions covered under the Prudent RX copay program will be covered at a $0 copay. Otherwise, medications in the specialty tier will remain subject to a 30% coinsurance. Now, this new RX program will also assist members in obtaining financial assistance from, let's say, drug manufacturers to reduce some members' cost, the cost share for eligible medications, thereby reducing overall out-of-pocket costs. For more information, you can contact our CVS specialty at 1-866-355-5999. using your benefits. So let's talk about how these plans work and how you can select the best plans for you and your family. Understanding your deductible. So let's take a moment to review this illustration to help better understand how an embedded deductible, how that works when covering a family under any of the TRS ActiveCare plans. If you look at the top left here, the Lawler family has a $5,000 family deductible. Each member of the family has a $2,500 individual deductible. In this example, if you look at the medical expenses for the year, John has met $250, Alex has met 500, and Anna has incurred $4,000 in medical expenses so far, which is more than her $2,500 individual deductible. So the moment Anna hits the $2,500 in expenses, at that point, she becomes responsible only for her coinsurance amount. Now, if you look at the medical expenses for the Lawler family combined, they've only met $4,750, which is still less than the $5,000 family deductible. So since Anna cannot contribute in excess of her individual deductible amount towards the family deductible, that means Alex or John would have to incur the remaining $250 before the coinsurance starts for the entire family. Now, I know these family deductibles can always be a bit confusing, but in essence, with an embedded deductible, an individual can meet their individual deductible and doesn't necessarily have to meet their family deductible before their coinsurance kicks in for them. So I hope this scenario explanation helps clear it up a bit. Network plan highlights. Both the statewide and nationwide networks offer strong access to care, but there are some key differences, so I wanted to highlight those here. Now, the statewide network, primary and primary plus plans, only offer in-network coverage within the state of Texas and is a physician-directed plan, meaning that participants must select the PCP that's in the network, and if they need to see a specialist, there must be a referral on file. Now, the plans on the nationwide network include ActiveCare HD and ActiveCare 2, which offers both in and out-of-network coverage. You don't need to select a PCP to access benefits. Referrals are not required to see in-network specialists. You also have access to both the statewide and nationwide networks, so you can't go wrong either way. Now, with that said, I wanted to share the value of staying within the network under your TRS ActiveCare plans. From our experience, we found that over 95% of our participants use in-network services to maximize their benefits. So here are just a few advantages of staying in-network. Participants will receive the highest level of benefits, which means keeping more money in their pocket. They don't have to file any claim forms, providers to do that for them. Balance billing is not allowed, so that'll give participants peace of mind. Even though the ActiveCare HD and ActiveCare 2 plans offer out-of-network coverage, participants get the most from their benefits when they stay in-network. But if a participant happens to go out-of-network, they just need to be aware that they will be probably paying more for the care, the benefit level is reduced, and they could potentially be balance billed. As you can see, you do have options, and you can choose with confidence knowing that both the nationwide and statewide network provides you with emergency coverage anywhere in the world. You can receive the highest level of benefits and usually pay less for care with in-network providers. And if you stick with in-network providers, you do have that protection from balance billing. Also, both the statewide and nationwide plans provide coverage for out-of-state covered dependents. Now, the nationwide plan provides this coverage without any additional steps. However, dependents on the statewide plans will require an attestation form be submitted before they'll have access to coverage outside of the state. And lastly, just a quick reminder, under the primary plus plans, there are no out-of-network benefits and non-emergency claims for out-of-network services will be denied. So we do want to take the opportunity to stress the importance of getting regular annual checkups. Now, preventive care is covered at 100% with no out-of-pocket costs when using in-network providers, regardless of the plan that you select. Any of the recommended routine, gender, and age-specific preventive care and screenings are covered. Now, this includes yearly general wellness exams, recommended vaccines, as well as screenings. With that said, it's important to know the difference between preventive and diagnostic care. Diagnostic care refers to the diagnosis, treatment, and monitoring of a disease or condition. So let's say you go in for your annual wellness exam, and during that visit, they find that you're a diabetic. Then that visit now is considered diagnostic and not preventative any longer. If your visit results in the diagnosis of a condition or treatment of an existing condition, this service is diagnostic. So I just wanted to make that distinction. Also, lab tests related to any illness or condition such as diabetes or asthma are not considered preventive and are covered under your deductible and coinsurance levels. And again, I'm only highlighting that because quite often these tests feel routine to the participant, and this can cause some confusion. And lastly, I wanted to share a new minimum age requirement for colonoscopies, which have been reduced from age 50 to 45. The minimum age for preventive mammograms is now 35, reduced from age 40, and prostate cancer screening is 45 and older. Now, these changes are effective 9/1/2022. Value in a PCP relationship. So, having a PCP plays a huge role in keeping participants healthy and lowering out of pocket costs. Even if someone rarely goes to the doctor or gets sick, making a PCP selection, scheduling a visit to see them, and having a relationship with your doctor is very important. First off, seeing a PCP is one of the lowest cost options of care. A PCP can easily treat many of your non urgent health issues, such as your colds, flus, allergies, and so forth. By visiting their PCP, a participant can make sure that they're getting the care that they need in terms of preventive screenings or immunizations, getting their regular checkups, and overall staying healthy. In addition, having a relationship with your primary care provider can provide peace of mind. The PCP knows the participant the best. They know their medical history, their lifestyle, and their preferences. And together, they can develop a plan that avoids high cost, unnecessary tests and procedures. And of course, people who see your PCP tend to live longer and healthier lives. So, to sum it up, a primary care provider is the single best resource for knowing and understanding a participant's health. Lastly, for those on the statewide network, the PCP is responsible for managing referrals to specialists. Okay, moving on to our Blue Cross Blue Shield tools and resources, which can help make everyone's lives a lot easier, right? The participant website should be the go-to website for all employees for any of their medical benefits and health and wellness information. It's a dedicated site for our TRS ActiveCare plans and has specific information for employees to utilize. Now, we do encourage everyone to be familiar with this website. That way you'll be well equipped on where to go and how to navigate the site. I won't read out all the bullet points here. However, the participant website has tools and resources to help find an in-network doctor, hospital, or other providers. Get your plan information. You can get the latest news and updates. In addition, this is where employees can log into their Blue Access for Members portal, also known as BAM. And that's really just a hub for all employees' medical benefit needs. So if you haven't done so already, the red circle here, you can click on that, go in and register for Blue Access for Members. It is important to know when you first sign up, you will need your member ID number and group number. And for employees that want to create their accounts prior to receiving their ID card, they can always contact our personal health guides at 1-866-355-5999, and they'll be more than happy to help. Additionally, this participant website is available in both English and Spanish. Now, once you're logged into your Blue Access for Members portal, participants can access the Provider Finder tool. So we're looking at the left-hand side of the screen here. We encourage employees to utilize this search function when selecting a primary care physician, so they will have it all at their fingertips. When they search for a provider, employees get more than just a list of doctors. They get quality destinations for facilities and physicians, including awards and recognition. They get enhanced demographic information on each provider. So you can find out about a doctor's education, hospital affiliations, and whether or not they're board certified. You also get customizable search options. So would you prefer a doctor who's female or can speak Spanish? And you also find patient reviews. So find out what others have to say about that physician. And you could even get alternative locations. So does the doctor practice at multiple locations? You can find the one that's most convenient for you. After completing a search and clicking on the provider's name, it's going to take you to the detailed provider page, which is shown here on the right. Notice the red arrow there. This is where employees can locate their provider's PCP ID. This PCP ID will be needed when you go through open enrollment and select your primary care doctor. Of course, at any time, if you're uncertain on how to navigate through the site or need assistance, you can definitely contact our personal health guides. Blue Cross Blue Shield ID cards. So this year, cards are going to be issued out for everyone, whether you're new to the plan or if you're an existing participant on the plan, and that's just due to the printed benefit changes. So for those already on the plans, they can continue to use their existing card for their appointments until they receive their new ID card. The member ID number will remain the same, and ID cards for the physician-directed Statewide plans will have the subscriber's name listed as well as the covered family member and their associated PCP. So this means that every covered participant on these plans will have their own ID card. A sample of the ID card for this is shown here on the left with the blue circle indicating the PCP. Now, ID cards for the nationwide plans will only have the subscriber's name on the card and it's never going to have the spouse or any other dependent's name. And a sample of that ID card is shown here in the middle. Participants on the nationwide plan will receive up to 2 ID cards per family. Employees can order additional replacement ID cards via Blue Access for Members portal. They can go directly through the mobile app, or they can just contact our personal health guides and they'll be more than happy to assist. All right, mobile access. Our mobile app has been a huge hit. It's very popular and user-friendly. Employees can stay connected and easily get to their TRS ActiveCare health plan information wherever they are. So I definitely utilize this mobile app for my doctor's appointments. I rarely even take my ID card anymore. I pull up my digital card on the app, so it's very, very user-friendly. Now, this app allows employees to find information quickly and easily. They can use the app to check claim status, track deductibles and out-of-pocket maximums. They could even view prior authorizations and referrals, or even their out-of-pocket spending. The app is also available in Spanish for both iPhone and Android users. So again, benefits are literally at the employee's fingertips. Our online tools help them stay informed and better manage their overall health and wellness and benefits. And lastly, just a few other things that they can utilize the app for. You can look for in-network doctors, hospitals, or urgent care facilities. You could download and share your explanation of benefits. You can even live chat with one of our personal health guides 24/7. So lots of great features. So now I want to take a moment to brag about our fantastic customer service support that's offered to our employees. One of the most useful resources available to you and your family are our personal health guides. I love to brag about our PHG team. So Blue Cross Blue Shield of Texas personal health guides are here to help you and your covered family members with things like finding and assigning a PCP, answering questions regarding benefits and coverage. They can also help check your status, prior authorizations, or referrals. They'll also be able to help you understand healthcare costs and options for care. They can even help you schedule appointments for doctor's visits and so much more. Again, you can reach out to our personal health guides at the number listed on the screen, the 866-355-5999, and they'll be available to assist you 24 hours a day, 7 days a week. Now on to my favorite part of the presentation, the value-added programs. Learn to Live. It's new for 2022 for TRS ActiveCare. It's one of the most common questions that we receive. What mental health offerings do you have? Well, we're happy to say it's here, our new digital mental health resource. It's an online CBT or cognitive behavioral therapy tool that can make it easier for members who would like to improve their overall mental health, wellness, or even if they've never received mental health treatments in the past, you can start your journey under the Learn to Live program. This is a new digital behavioral health platform, and it's available for health concerns such as depression, anxiety, social anxiety, insomnia, substance abuse. Participants can access this tool through the Blue Access for Members Wellness tab and get started right away at no cost to them. Member rewards. So most of us look for value when we're shopping for everyday items, right? So we thought, why not apply this practice to shopping for healthcare services? A lot of times prices for the same quality medical services can differ by thousands of dollars just by going to a different provider, even within the same region or health plan network. So for me, being from the Austin area, I usually compare it to where you park your car, the $30 lot or the $15 one just a few blocks away. With member rewards, employees can compare healthcare services in a similar way. And let me tell you, the difference can be significant and help minimize out-of-pocket cost. So to be clear, Member Rewards is a program that incentivizes participants just like you for using lower cost, high quality providers. Each procedure has a specific reward amount, which will be placed into a healthcare account, which can then be used to cover future patient responsibility. So you literally get rewarded for making good choices and still utilizing a recommended provider. Participants on the Primary and Primary Plus plans, and now our Active Care 2 plans, can simply log into their Blue Access for Members account. They compare the cost, obtain a referral to schedule the procedure, and start earning the rewards automatically after they get deposited, the claim's been processed and verified. Participants can redeem annual rewards up to $599 per plan year. The remaining balance will be rolled over year after year and doesn't expire unless you leave the plan. So just to continue with the member rewards, we are excited to announce member rewards is being expanded to ActiveCare HD for 2022. So member rewards on the HD plan work similarly to the primary and primary plus plans as you compare providers, you schedule your appointments, and you earn rewards up to $599 annually. However, there are a couple of key differences to note. The HD plan participants earning rewards can only submit for reimbursement on dental and vision expenses. Participants on the HD plan will need to complete the TRS ActiveCare member rewards expense form located on the participant website shown on the right side of the screen here and include a copy of the receipt for services. As a reminder, the rewards do not expire. They'll roll over year after year unless you leave the plan. But if you switch, let's say from the primary plus plans to the HD plan, they accumulate and they'll roll over to the new plan as well. So now that we touched on the differences between the member rewards for the TRS ActiveCare plans, the chart in the middle here on the slide provides you a quick visual representation of the similarities and differences on how participants can utilize their member rewards. We also have features like the expanded member rewards with over 119 new eligible services, including labs. Now, lab services are highly shoppable and are one of the most variable items based on location received. So, quick story with my member rewards. I had an incident recently where I personally had lab work done at a specialist office, but I didn't realize that they were affiliated with the hospital, and I ended up receiving a bill for over $250. Now, these same labs, after shopping around, would have been a lot less at LabCorp or let's say Quest. So, a huge lesson learned for me. I know now that I can receive rewards for going to the lower cost location, and that's definitely going to help me take charge of where I get my lab services done in the future. So with that said, we do also have the dynamic incentives that have been added. So what does that mean to you? Simply put, there are more incentives in more eligible locations. In the past, the rewards were only applied to the top 2 or 3 low-cost providers, but now with the dynamic incentives, there's going to be additional low-cost provider options rewarded based on a percentage of savings instead of a fixed dollar amount. So increased opportunities to save. Member rewards is honestly one of the best tools you can utilize. The average rewards received here on the bottom of the slide show the actual dollars going back into your pocket just for utilizing this program. We want to ensure that every employee enrolled in the primary plus, and now the HD plans are aware that they can take advantage of this new value added benefit. All right, moving right along to musculoskeletal alternative care. Depending on your plan election, participants in pilot regions 4, 6, 10, and 11 could be eligible for MSK programs at no cost. So ROSTI and Hinge Health are 2 MSK programs that not only focus on chronic pain relief, but target pharmaceuticals, imaging, surgical prevention through a variety of at-home exercises and physical therapy. So Hinge Health provides all the tools you need to get moving again from the comfort of your home. Here are some of the ways your treatment plan could be tailored just for you. You could get a personal care team, including a physical therapist and health coach. You can schedule personal physical therapy sessions as needed. You can receive wearable sensors and a tablet that give you live feedback on your form in the app. You can also get a second opinion on your recommended surgery or treatment plans from orthopedic surgeons, and you also have access to the program for 365 days. If you don't have pain and are just looking to stay healthy, you could sign up for their free app. Recommended exercises will be tailored to you based on your job and your lifestyle. And for Arasti effectively manages and treats all acute and chronic MSK conditions, and it helps reduce the need for surgery, high-tech imaging, and prescription drugs, resulting in lower overall cost of care. Now, virtual care and treatment are led by an Arasti provider, and they include provider-guided myofascial release and mobility and stability rehab exercises. Each patient will receive a customized recovery plan and a remote recovery kit and unlimited access to the provider via mobile app for 12 months. Their Arasti provider can also help in transition to an Arasti clinic if requested by a patient. So again, we're very excited about our new Arasti and Hinge Health pilot programs, and we want to make sure that you're aware. Also included is a nurse line staffed by registered nurses 24/7 to conveniently assist you with your health questions. Nurses can answer general health questions and guide you to the appropriate level of care, whether that's a visit to their PCP, virtual health provider, urgent care, or even the emergency room. Additionally, you can access an audio health library that has information on over 300 topics. And that's available both English and Spanish. To reach the nurse line, you can call the number listed on the screen, which is also located on the back of your ID card. Women's and family health. So TRS does recognize and understand the needs of their population, which is predominantly female. Therefore, we have tools to help employees who are pregnant or planning to get pregnant at no extra cost. They're called the Ovia Health apps, and they're for tracking one's cycle, pregnancy, and baby's growth. Each app has videos, tips, coaching, and more. So the Ovia Fertility app helps a woman track her cycle and predict when she's more likely to get pregnant. Ovia Pregnancy helps a woman track her pregnancy and baby's growth week to week leading up to the baby's due date. Ovia Parenting helps track the child's growth from birth through 3 years old. In addition, Well on Target also has self-guided courses about pregnancy that you can take online, and they cover anything from healthy foods, body changes, labor, and more. Plus, for participants with a high-risk pregnancy, Blue Cross Blue Shield will provide support from maternity specialists to help care for the participant and her baby. Now, TRS ActiveCare plan also covers electric breast pumps, lactation counseling, family planning services. To learn more, you can download any of the Ovia Health apps in the in the Apple or Google store. You'll just need to have your member ID card handy so you can enter the Blue Cross Blue Shield ID number when you set up your account. The Well on Target participant portal is where you can start engaging in wellness activities that are personalized just for you. There are many activities on Well on Target to encourage employees and help them along their wellness journey. Activities include taking a health assessment, various trackers, syncing a fitness or nutrition device or app, self-management programs on key health topics, or even access to a personal health coach. And I know I mentioned the health assessment. It's available to you through our participant dashboard. Think of it as your personal wellness report that's generated after you complete it. So you'll answer some questions about your current health and wellness journey and where you want to be in terms of overall health. This information stays within the portal for you to go back and update as you progress throughout the year. Again, it's really more of a helpful guide that you can utilize to self-manage in order to maintain a healthy lifestyle over time. So speaking of coaching, we have our interactive health coaching. I just mentioned that through our Well on Target portal, employees can access a health coach. So let's talk about more about what they can do for them. Once you complete your health assessment, that'll trigger an outreach from a coach. You could also enroll in health coaching at any time through the Well on Target portal. There are 9 coaching topics that you can select by clicking on the topic under the drop-down menu. So for example, if you click on the topic Improve Fitness Level, you would go in and set your goals in terms of minutes, days, or weeks for, let's say, cardio and strength training or stretching. And then you'll be able to see your action steps that are required in order to complete that goal. So after the goal is set, then a coach will reach out to the participant, or they can reach out to the coach by calling directly or by secure messaging. Coaches are available from 7 a.m. to 10 p.m. Monday through Friday and 9 a.m. to 4 p.m. on Saturdays, and this is Central Standard Time. Lastly, a certificate of completion can be requested from the health coach once the individual goal is achieved. Remember, coaching is purely optional, but accountability is a key part of success. Another one of our programs are our Blue Points. Participants get rewards for doing eligible activities through the Well on Target portal by doing things like syncing a fitness app or device, taking the health assessment, which automatically gives you 2,500 points, by the way, and you could easily accumulate points throughout the year. You can also utilize these points and redeem them on our online shopping mall, which has over 1 million products. So I personally love this program because I've actually utilized it myself. I've recently redeemed some points that I accumulated just this past year, and I got an air fryer. So I'm excited. It was a $200 value that I got for free. The points add up quickly and they never expire. They roll over from year to year and they can be redeemed every plan year up to $599. So we do encourage everyone to check out our online shopping mall to see all the great items available to you. And just to give you a few quick examples of what we have things like kitchen appliances, luggage, designer handbags, sports accessories, watches, and a plethora of more products. And also, let's say you don't have enough points to cover the whole amount. Well, that's okay. You can just pay the difference with a credit card or a debit card. Another great benefit available for our participants is the fitness program. Now, the fitness program provides you with tiered membership options for unlimited access to more than 10,000 participating facilities nationwide, from gyms and sports facilities to special fitness studios and more. Members can choose the membership plan that works best for them and their budget. We have a digital only feature for only $10 a month. That's without a registration fee. And you can attend live classes or access the library when it's convenient for you. The thing I like most about the fitness program is I can go to places like Planet Fitness, Crunch Fitness, or even my local YMCA, all under one membership. There is a one-time initiation fee across all four tiers of $19. However, there's a family bundle also available, which saves you an additional 12% when added to a current account. And lastly, studio classes are available to members even if they don't have a gym tiered membership. The studio classes are purchased as a pay-as-you-go option with a 30% discount on every 10th class. So lots of flexibility here with the fitness program and access to the digital content. All right, so we're getting closer to the finish line here. Another opportunity for Blue Cross Blue Shield members to save money is to join Blue 365, which is our discount program. So this is sort of like a Groupon type experience, if you will. You can find more information about Blue 365 listed on the Blue Access for Members homepage. Just click on the quick links. And participants would just need their medical ID card to register, then simply create a username and password. They'll receive emails with wellness discounts on a variety of items such as eyewear, fitness gear, Fitbits, or even hearing aids, which I hear can be very expensive. And I'll actually be searching for some here for my dad here very soon. So it's definitely working. It's worth looking into. For additional information, participants can contact the customer service number listed on the screen here. And that concludes our 2022-2023 TRS ActiveCare annual enrollment presentation. Thank you so much for joining me today. It's been a pleasure, and it's my hope to partner and help you take charge of your personal health care needs. Thank you.